Hello friends, Mike Little here, your Executive Director. I have 3 updates today about the Foundation that I'd like to share with you. The first one is that our grants deadline is coming due March 1st. So if you know any groups who are looking to create innovative solutions or improvements to oral health care in North Dakota, let them know that they can apply to a grant through our foundation. They just go to our website, nddental.org, and they click on the grants button, and the process is all laid out there for them. Secondly, NDSCS has their application deadline coming up March 15th for their dental assisting program. So we have been presenting we just did a recent presentation to 8th graders. We have a presentation to high schools all across North Dakota coming up with the Bank of North Dakota. That's a virtual presentation where we're on a panel talking about dental assisting. And we also are doing targeted social media advertising to high school students as well, and target markets to know about dental assisting as a career option, and have done some recent updates to our website, brightfuturesinDentistry.com. But if you know of anybody who's interested, March 15th is a big deadline. Also, the legislature will be voting March 5th on some administrative rule changes with the Board of Dental Examiners, with the way that they look at hours that high school students would be spending in a clinic setting on training to be able to take different accreditation exams and having those hours apply. So that impacts the Dickinson High School program, and also any other high school program that we would be looking to start. We've already started conversations with a consultant who would help us first spread probably to Bismarck and Minot, the high school curriculum for dental assisting, and then we'd look at high schools across North Dakota from there on out. The third thing I wanted to talk to you about was we kicked off the engagement tour this week, and we met with Anderson Dental here in Fargo, and it's just down the street from the Dental Foundation, 5 minutes away, and we really shared these. We showed up to talk about our foundation, so we shared these brochures that have information about our different programs and impact. These are available on our website at nddental.org under impact, or we have hard copies as well, so you can ask and we'll ship these out. But we also brought lunch, so we provide Chick-fil-A, and really we're there to listen. So we were there to share this information, and we were also there to listen. So here's Ashley, and here's myself connecting with some of their staff. And we really are grateful for being able to come in. So we asked them a pre-survey question and just said, what do you know about the foundation? Not a lot. There really wasn't a lot that they knew about us. And then after we explained what we do in our programs, we asked them to talk about what was most interesting. So you can see their number 1 most interesting choice that got the most votes was Bright Futures in Dentistry. And then the second number 1 option was 1 million brushes. And that was also the highest. Number 2 was 1 million brushes as what they were interested in. So Bright Futures and 1 million brushes tended to be fairly high in terms of interest. We said, what is the biggest problem with healthcare, oral healthcare in North Dakota? Cost came in as the number 1 issue as seen by this group. And then we asked them to help on a scale talk about after the presentation, how much do they understand about our foundation. As you can see, it improved, which is good. We did get a couple of 7s. We would like to see that up in 9 or 10 range, but I think maybe a little bit of a longer presentation next time would work. So then we said, what could we do differently to ensure all oral health needs are met? And the answers we got around this, we broke up the groups into smaller groups and had them do discussion and really some kind of strategic planning and brainstorming. We had a lot of feedback around advertising, letting people know about these programs, visiting lower income elementary schools, and connecting. So a lot about connecting programs. So connecting our toothbrush program with our education program, with in-school care programs, and a lot about connecting with parents of elementary school students, going out in the community, and really a big focus on education. There is also some feedback around pairing people in need with dentists. So creating a list of dentists who are willing to do charitable care and connecting the two. And then also some talk about being able to share information and creating a network of feedback across our state to learn what goes well, what doesn't go well, and how to understand how to be able to help in the community. Anyway, a lot of really good feedback. We're excited about where this is going. If you know of anybody, or if you would like us to connect with you about the foundation, please invite us. We're on a tour. We're going in the Fargo area now, but expanding across North Dakota. Take care. Thanks for your time.